People are realising that you have to think long term when it comes to sort of financing a health sector. Expanding the amount of money you're putting into health and making sure that money is used well. You need long-term strategies and you need to sort of raise resources on a long-term basis. You can't rely on international donors, you can't rely on people paying out of their pocket. So actually getting ways of mobilising resources and sustaining them in the long term is now become very, very important for every country around the world.
A few of us were called to attend the Health Financing and Governance workshop in Lagos. It was an eye-opener, I must say. It was an eye-opener.
There was an elaborate healthcare financing training organized in the month of June where players from the states were actually brought together to look at what are the basic concepts of healthcare financing and then to look at the existing policy and legal framework so that states will make contributions so that they have their capacity improved.
A lot went on in the workshop, but I think we all came out the better and more knowledgeable on health finance.
We quickly adopted the healthcare reform, one of which was for us to ensure that we deal decisively on this financial risk people exposed to when it comes to seeking for healthcare.
It's going to mean a lot of things for a lot of people. For the sick, it's going to be hope for a new dawn. Hope that the sick person can go to the hospital and be attended to. It's something that is really going to be very, very laudable. It's a nice innovation. It's something that will be sustainable. It's something that will work.
To make decisions about in a health system or to improve a service, you have to know what the outcomes are like. Are people getting healthier? You have to know whether your system's working well. Are your workers in place? Are they performing well? You have to know how much finance you have in place and is it being spent on the right things. And you also have to know what your users and the end recipients think of those services, all of which involves data, gathering data and feeding it back to the decision makers.
We've tried to compile and consolidate all of the information that's available around health system strengthening to try to look at what are the effects, what is known about how these different types of interventions affect health. The report, The Impact of Health System Strengthening on Health, this was a really groundbreaking initiative. This is really the first time that we can say confidently that health system strengthening interventions have positive benefits, demonstrated positive impacts on health status and healthcare utilization.
The evidence is getting compelling. It shows that health system strengthening has a huge impact. And we now need to we now focus on how to get that message to people so they truly understand that these investments work, they lead to better health, and they're essential for universal health coverage.